Well, good afternoon, everyone. My name is Sean Kennedy. I'm the Director of eHealth Programs here at the Massachusetts eHealth Institute, and welcome to our Connected Communities Implementation Grant Program webinar. Over the next 30 to 40 minutes, I'm going to walk you through the following agenda, leaving roughly about 20 minutes available for questions. We'll do an introduction here, legal considerations. We'll walk through who MeHI is and some of the things that we do. We'll then walk through an overview of the Connected Communities Grant Program, and then get a little bit into the background, eligibility criteria, milestones, application process, and timelines, again, and leaving ideally 20 minutes or so available for questions. So with me today are Ross Venables, he's our Grants and Contracts Administrator, and Olivia Joplin, who is our eHealth Programs Coordinator. So we're going to walk through this presentation. We're going to be sharing a lot of information. So I'd ask that you put your questions into the chat section of the GoToMeeting as we go along, and at the end, we'll start answering all the questions. Questions that are not answered as part of this webinar, we'll be sure to answer and reply back to you in the form of a question and answer document. So with that, I'm going to toss it over to Ross, and perhaps you can walk us through some of the legal considerations for this program, Ross.
Great, thank you, Sean. Just going to walk through a couple of the legal issues that we've been asked to highlight associated with this program. First, the the solicitation has been posted to both the MeHI and to the MassTech websites. We also post to the Commonwealth procurement website, which is combis.com. To the extent that anything stated or presented in this webinar is inconsistent with the actual document, the solicitation document, that document will govern. MassTech reserves all rights to amend, modify, or otherwise to clarify the solicitation and any written answers to questions presented. As I said, we'll be posting to MeHI, MassTech, and the Combis websites, so please check back to those sites for addenda or modifications to the solicitation. Please review the solicitation document carefully. Any non-responsive applications will be rejected. MassTech Collaborative is going to be the contracting entity on behalf of MeHI. MassTech was established pursuant to MGL, that's Mass General Laws, Chapter 40J. That's the statute site. We're an independent authority of the Commonwealth of Massachusetts. The eHealth Institute, MeHI, is a non-divisible component of MassTech. It functions as a business division of MassTech. Okay, thanks, Sean. Back over to you.
Great, thanks a lot, Ross. Appreciate that. So starting out, Ross just gave a nice introduction to the MassTech Collaborative and MeHI being a division of MassTech Collaborative. There are two other sister agencies that exist under Mass Technology Collaborative. There's the Mass Broadband Institute. They've done some things like Mass Broadband 123, which is rolling out fiber across western and central Massachusetts. And they have Mass Vets Advisor, which is a benefits site for veterans. It's a pretty interesting resource. If you know any veterans, send them to massvetsadvisor.org. We then have the Innovation Institute, and they've got a number of efforts that they're working on around the Tech Hub Collaborative, Big Data Consortium, Advanced Manufacturing Collaborative, Innovation Index that they produce on an annual basis. We at MeHI are the designated state agency for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health IT, promoting health IT to improve the safety, quality, and efficiency of healthcare here in Massachusetts, and advancing the dissemination of electronic health records in all healthcare provider settings. We really do vision ourselves to be a global leader in e-health. Massachusetts of itself is a global leader in many ways in healthcare, and we'd like to see Massachusetts as a global leader in e-health. Our connected communities enjoy better health at lower costs and serve as models of innovation and economic development, something that we're certainly aspiring toward. Our mission that we work on every day is to engage the healthcare community, catalyze the development, adoption, and effective use of health IT. And we're looking to go after primarily 4 goals: working toward the 100% adoption of interoperable EHRs, supporting health reform for better health, better care, lower costs, really working on consumer engagement and working to get patients and caregivers more engaged in their healthcare through e-health technologies, and working to grow and promote innovation in the e-health cluster, growing the innovation economy here in Massachusetts in that e-health sector. We would like to think of ourselves as your go-to resource for all things health IT. We've got programs, we've got services, we provide education, opportunities for collaboration, and as you'll see today, we do a fair amount of funding. Generally, these all fall in that category of e-health assistance. So let me go into the Connected Communities program and give you a sense of where all this started from. We did a number of studies a while ago. We've done amassing of numbers across the state to understand the adoption of health IT. And while we understand it to be high adoption in Massachusetts among organizations and providers of electronic health records, we're at 79% as of last year, what we're finding is that providers within or across the communities are not connected in a manner that optimally promotes coordinated care and population health. Further, as part of our legislative mandate in Chapter 224, we're called to generate an e-health plan. We've called that a statewide e-health plan, and we understand that to be a community-based or comprised of community-based implementation plans that assess a municipalities or regions' readiness to implement and use electronic health record systems and an interoperable electronic health records network within a referral market for a defined patient population. So there is a charge through Chapter 224 for us to work out a way to implement e-health and broaden it across the state based on these geographic regions. So as part of our program, we've identified a number of objectives. We said we want to catalyze interorganizational collaboration. We want to advance the use of interoperable electronic health records, and we want to drive a more connected healthcare ecosystem here in the Commonwealth. So the first step to doing that was to generate our communities. We worked with the Health Policy Commission. We adopted their secondary service markets. So we're nicely aligned to the agency that's really leading health reform here in Massachusetts, and we've identified these 15 communities. We've further taken those communities and we've clustered them into 3 regions. These communities and the regions really are an effort for us to provision resources across the state and gather feedback. For each of the regions, we've identified a community e-health manager. If you haven't met yours yet, you certainly will in the near future, but we've got one for Western Mass, Northeast Massachusetts, and we're still looking one for the Southeast Mass. So if you know anyone, please let us know and be happy to consider them for that role. Our approach across this effort and really growing the Connected Communities concept is really to engage and collaborate with a diverse set of community stakeholders. We're looking initially to gather their feedback through a comprehensive statewide needs assessment process that we recently completed. At the conclusion of that, we're working on developing community e-health plans. These are for each of those 15 communities. We work to develop these e-health plans and assessments that would understand the unique needs, issues, barriers, and ideas for those respective communities. The current assessments that are from each of those communities are now available on our website. And I would encourage you to click on that link when you get these slides and take a look at your particular community or other communities to get a sense of some of the findings that we discovered in those engagements. We then were working to feed the needs assessment and these community health plan findings and priorities into development of the statewide e-health plan. We've got a draft of this plan in place, and we're working to coordinate with other entities to improve this as we go, looking to release this in the fall timeframe. And we're working to award community grants aimed at priorities identified from the needs assessment and these community health plans. And these grants will really work to demonstrate community collaboration. The e-health community managers are really an at-large resource. They're available to you in really working to foster that collaborative environment across the state. So that's the brief overview and our initial approach to the Connected Communities program. And one of the big efforts, as I ended there, was to offer a funding mechanism to get the community collaboration going and showing it actually working. So these Connected Community grants are a big effort and a big part of this program. So some of the requirements and guidance here, we're really seeking applications that propose projects that promote community collaboration and action and strengthen transitions between different care settings, improve cross-setting care management among inter-organizational care team members. While not required under this grant, applications will be reviewed favorably that also include projects that use notifications to facilitate improved care management and demonstrate community collaboration around a real-world, practical, measurable need aligned to a specific focus area. This grant program seeks to fund impactful projects that focus on strengthening these different information workflows. So the intent behind here is to really encourage care providers to work together to develop coordinated strategies, processes, and workflows that leverage eHealth capabilities of their community. We want you to build upon previous investments from related programs, some of which come from other agencies. So MeHI funded the highway implementation grants, the vendor grants a year or 2 years ago, but we have a number of other sister agencies that are funding other programs. The CHART program has a big investment of health IT, Prevention Wellness Trust, you've heard of Meaningful Use, and there's a number of other programs out there funded by the state, and we're looking to leverage those investments as we build out this connected communities. And also want to capitalize on community collaboration that's already started under this statewide needs assessment and is supported by our eHealth community managers and turn this into community supported action. So one of the big focus areas for this grant is care coordination, as I mentioned. We're defining care coordination and breaking up into two parts. One is care transitions, which is intended to focus on transitions of a patient between different acuity care settings. So from a hospital to a skilled nursing facility, from a skilled nursing facility to home health, from a hospital to home health, just a couple examples of those transitions that we're looking for. And then the other part of care coordination would be cross-setting care management. So this would reflect care for a patient by a team that spans different care settings. So a care coordinator supporting the integrated care of a high-needs patient across inpatient, outpatient therapy, and in-home care on a more ongoing basis. To be eligible for this program as a lead on this program, so the applicant, it's limited to organizations that are treatment payment healthcare organizations as defined under HIPAA. Collaborating organizations may be TPO or non-TPO type organizations. And MeHI encourages additional participation and collaboration with civic and nonprofit, potentially non-TPO organizations to create a true community approach to addressing health issues. So look at local municipalities, townships, local public health departments. Those would certainly be encouraged to be part of this effort. So let's look at the award structure. This is a milestone-based program. Milestone-based payments will be paid based upon achievement of 4 milestones over a 2-year period. Generally, MeHI envisions that in year 1, the grant is focused on building and strengthening information pathways, whereas year 2, the grant is intended on measuring progress, performing quality improvement, and meeting volume targets. So there is what we call a planning element to this. The planning element is, the major element of that is the transformation plan. The transformation plan will be paid out at 10% of the estimated full grant award up to a maximum of $25,000. The deliverables that sit under here are the transformation plan as approved by MeHI, a diagram illustrating the information pathways to be created or leveraged for this grant, a detailed cost budget, and then a completed MeHI HIE use case development form to include volume targets for each information pathway that is going to be leveraged under this grant. And we say 1 for each the distinct clinical and business use case or scenario that is identified. So the first milestone under this is a development and testing milestone where you'll get a 25% payment for the remainder of once you extract that $25,000 planning payment. Deliverable here is an attestation from the grantee and collaborators that test transactions are being sent received for the use cases described in the use case development form in test environments. We're also looking for a copy of the HIE or Mass Highway Participation Agreement from the lead organization, each collaborating organization, description of the organization's policies and procedures to protect electronic health information, and identification of impacted workflows and description of preliminary workflow enhancements. In milestone 2, it's about prototyping care coordination. So here we're looking again from an attestation from the grantee and collaborators that real or production transactions are being sent received for the identified use cases described in the use case development form in the production environment, substantiated by a transaction log from the sponsoring HIE detailing the test transactions and organizations involved. We're also asking for what we call logical process diagram, which is described in the RFP, and a process improvement plan, identifying those elements that you're planning to improve upon that's going to come up in the next milestone. And then any updates for the following items there around a description of your health IT environment, policies and procedures, the HI use case form, and any changes to the transformation plan. In milestone 3, it's about strengthening workflows. So you've established workflows in a test environment, you've tested them in a production environment, and now it's working on strengthening those workflows, building for your volume targets. So again, 25% payment, and looking for an attestation by grantee of completion of their process improvement plan along with substantiating document. And there's some further description of that in the RFP. A description of the approach to operationalizing opt-in consent for your respective HIE in the Mass Highway, and updates to the same documents as discussed in milestone 2. And then milestone 4 is really achieving your volume targets. So the use case volume table that you identified as part of your use case document will be delivered to us, signed off by an officer of each participating organization. A log report substantiating transaction volume from grantees HIE and a use case expansion plan. The basic idea here is at the end of this 2 years, we're interested in what your thoughts are on how you would grow more information pathways, more trading partners, and really grow the connectivity within your community. And then there will be a final report. So let's go into the application process and some of the evaluation criteria. The way we've designed this program is really to encourage maximum participation. We offer a pre-application tier and an application tier. Submitted pre-applications will be reviewed by MeHI. MeHI does reserve the right to have pre-applications reviewed by an external review team and to provide feedback on pre-applications. This feedback may include recommendations to applicants to combine or adjust projects to improve the chances for success, take advantage of economies of scale, and other considerations that may increase the impact of this program. So our first opportunity for substantial feedback will come after the submission of your pre-applications. Only organizations that submit a pre-application and are invited by MeHI to submit a full application will be eligible for funding under this grant program. Full applications will be reviewed by MeHI and an external review team, and meritorious full applications will be awarded a community implementation grant. For the pre-application, this is a short pre-application, 2-3 pages, and shall include a basic overview of the proposed project. So these are the elements. There is an attachment D. It's the application summary sheet form that we'd ask you to complete. We'd ask you to identify each collaborating organization, provide a project overview that includes a summary, goal statement, project objectives, expected outcomes, and measures, an estimate of the grant funding requested. This is not a full budget. It is just an estimate of what you expect to spend, and a list and summary description of other state-funded efforts that you were awarded to the applicant or collaborating organizations that include an investment of health IT. This is not intended to be a big, long document. It is probably a 2-table document where you list the investment, the funding investment, and a summary of what you're doing with respect to health IT under that. Upon written invitation from MeHI to submit a full application, the applicant will be required to submit an application package that includes all the following elements. So these are more described in the RFP, but there's a proposal narrative. Then there's a number of forms, eligibility substantiation. We're asking your current use of health IT, and this is for the grantee or the applicant as well as the collaborators. Officer certification form to a number of items they're being asked to certify. Signed grantee organizational approval letter, sign collaborating organization letter of support stating the collaborating organization's support for and intended participation in the proposed project, an application summary sheet form in attachment D, an authorized applicant signature and acceptance in attachment E, and then exceptions to the general terms and conditions document that will be part of the contract, which is attachment F. So as part of the proposal narrative, these are the primary elements that exist under there. There is an abstract. We'd ask for you to write that very thoughtfully because that will be the first opportunity to orient reviewers to your proposal. Limit to 500 words, but we give some further guidance in the RFP of what elements should be included in that. A description of your statement of need, the convening ability. One of the things that we're interested in this grant is your ability, whether it's the applicant or collaborators, their ability as a team to convene multiple organizations together and get them to do work together. A project approach, collaborating organizations, the health IT environment. So this is for those TPO type organizations. So we wouldn't ask this of those that are non-TPO type organizations, so those collaborators. But if you are TPO, whether you're an applicant or a collaborator, we'd like this from you. Health system integration, it just describes how you're going to integrate this project into other aspects of your environment. In-kind resources that you're proposing. What's the value of this investment? We'd like you to describe your anticipated challenges and then submit a detailed budget. And there's a budget template provided under attachment B1. And then integration with other state-funded efforts. We would like a description of how, if you do have one of these other funding vehicles available to you, how you're going to integrate this effort in with those. And I think there's going to be a lot of opportunities for that to occur. So kind of a long bulleted page here, but successful full proposals shall address and describe in the project approach how project participants' efforts will address the needs of a community for those two aspects of care coordination. So again, care management, care transitions. How project participants intend to identify shared patients across organizations. How project participants will improve and strengthen related workflows. How project participants will connect and utilize the highway or an HIE HISP that is capable of transacting via the highway. Project will enable access to timely, clinically relevant information. How project participants will implement tightly scoped clinical use cases so that it is simple enough to plan, test, implement, and move into production within a 6 to 12 month time frame. Again, we're looking for year 1 to be that, and year 2, remaining time frame can be spent improving the pathway and workflows to attain volume targets. How the project will support improved outcomes and or efficiency. So reduce hospital readmissions, improve medication reconciliation, reduce preventable medical errors, avoid duplication of tests are some examples. How the project will leverage existing health IT and lightweight add-ons, so enhanced EHR functions and or modules. And how project participants will involve clinical and or business leadership in the program. So there is what we call a community planning award part of this. So for quality full applications that show promise but need more work, they may be awarded what we call a community planning award of up to $25,000. Applicants awarded a community planning grant will be required to develop a transformation plan. Upon completion of the transformation plan and related deliverables, so the use case form and a couple others, MeHI may, based on funds remaining, offer a community implementation grant award. And applications will be reviewed on the following criteria. We'll look at compliance, need, feasibility, ability, capacity, commitment, and impact, all of which are described in our RFP, or the solicitation, sorry. Some other program requirements. So for those organizations or those applicants that are awarded a Connected Community grant, you'll be required to do the following. Develop a transformation plan, commit to achieving all grant program milestones and deliverables, and where applicable, commitment by each collaborating organization to achieving a deliverable. Commit to adhering to the care transition and care management focus areas and related requirements and intentions. Commit to measuring progress against the mutually agreed to metrics. include the participation of multiple unaffiliated collaborating organizations that includes at a minimum a behavioral health and a long-term post-acute care organization. While we're not specifying the number of collaborating organizations, roughly 4 to 8 TPO-type unaffiliated collaborators would be expected, with 8 or more total collaborators, affiliated, unaffiliated, TPO, non-TPO, encouraged. And again, civic organizations such as towns, cities, schools, public safety can be included as collaborating organizations, and preference will be given to applications that include such collaborations. We also have a requirement to establish what we call a community collaboration that aims to engage community stakeholders more broadly than the grant and may serve as a forum to establish connections and exchange best practices. This will also lead into your discussion in milestone 4 about how you would broaden the use and participation in your community efforts. We have not described this in great detail in the solicitation. We're looking forward to hearing from you about ways that you could establish this community collaboration to really get more people connected and discussing how health IT can support community efforts. We'll submit 2 semi-annual reports, a final report at the end of the 2 years, and attend an annual grantee in-person event. And then cooperate with MeHI to measure and publicize the impact of the project on healthcare cost and quality in the community. MassTech will incorporate into its contracts with program participants a requirement that if the participant does not achieve at least milestone 2 within the period of the agreement, they are required to return 50% of the incentives that they have received. So here's the timeline. We posted it at the end of May. Today is June 4, the first webinar. We've got another webinar next Wednesday at 12. So for those that want to hear me chat again or want to invite others to participate, that is the opportunity. Pre-applications are due on July 1st at 4 p.m. It's really important that you do not miss the deadline. These are electronically submitted, but July 4th, 4 p.m. July 1st, I'm sorry, at 4 p.m. Eastern Time is the required receipt time for those. One submitted after that will not be accepted. The pre-application questions, so for all those questions you may have, we'll certainly answer those along the way, but June 19th at 5 p.m. is the last date that you can submit those questions for us to answer them. We will post the question and answer file on June 24th at 5 p.m. So if we can do it earlier than that, we certainly will, but at the latest, June 24th at 5. And then the invitation to submit a full application will come by the end of July. Application questions for the full applications will be due August 5th, with the full question and answer file posted on August 10th. And then the date at this point for the electronic applications, full applications being due is August 20th. And then hard copies due the day later on August 21st. And then a notification award coming in September. So I think a key distinction here is the pre-applications, only an electronic submission is required. For the full applications, it's both an electronic on August 20th and hard copy on August 21st. So questions may be submitted by email to us at proposals@masstech.org. All pre-application questions will be received by 5 p.m. on June 19th. Submissions by email are encouraged. Before you submit questions, please review whatever Q&A file is available. After this webinar, we will certainly collect the Q&A, the questions we have, and post answers to those as soon as we can. So there will be a file up there, I suspect within the next week as a starter. So you can review that prior to posting your questions on June 19th. And the final pre-application question responses are due on will be posted on June 24th at 5 p.m. And that'll be posted on the MeHI, MassTech, and Combi's website. And I encourage you to visit the MeHI website for more information. So with that, I tried to leave plenty of time for questions if there are any. And okay, I see there are a few questions, so we will take those now.
All right. First question is, can a behavioral health organization serve as a lead agency?
Yes.
Great. How is this different than the SIM grant e-referral process? Can we build on this?
From what I know about the SIM e-referral process, it is definitely a related but different activity. I would encourage you definitely to build upon that. That would be one of those programs that if you do have that funding or participating in that program, I would definitely encourage you to cite that in your pre-application and then describe that, how you'll integrate with that as part of the full application. But yes, that would certainly be encouraged, is coordinating between the two.
What is a TPO type organization?
A treatment, payment, and healthcare operations organization. This is cited, pardon me as I'm blanking this, under HIPAA. I will, under definitions, just one moment. I'm just going to read the definition from our solicitation. So it says organizations involved in patient treatment, payment, and operations. Examples would be practices, plans, hospitals, as defined in the privacy rule at 45 CFR 164.501. And there is a website in there to describe those more fully.
In the pre-application, does attachment D count towards the 3-page limit?
No, it does not.
Is there an expected outline and format for the pre-application document?
What was described in the RFP or what is listed in the RFP would be the expected elements of the pre-application. There is not a specific template that we have for it. Attachment D is a templated document that you would take out of the RFP and complete, out of the solicitation and complete, and then in a Word document to use the other items as perhaps section headers. But I would use the solicitation as your template.
May existing use cases be expanded to help support the efforts of other communities invited to complete the full application?
Yes. So one of the things that we want to work to avoid is out of this effort, we don't want to pay for a use case that was developed under another grant. However, we are looking to expand existing use cases. We are certainly looking to bring on more trading partners, do more volume of existing use cases, but would certainly encourage new use cases to be developed as well. But if you have an existing use case, broadening or expanding on that or strengthening it is certainly something that we want to look to do under this program.
Will the presentation slides be available?
Yes, they will. We will send them out in the next day or two.
What's the minimum number of collaborating partners allowed to start with?
We haven't defined a minimum number per the solicitation. So I will say what I stated in the solicitation is that we'd like to see, I believe it was 4 to 8 TPO type. Pardon. So what we say here, while we are not specifying the number of collaborating organizations, roughly 4 to 8 TPO type would be expected with 8 or more total collaborators. So I would say that to be sufficiently strong proposal, you would need to have a minimum of 4 collaborators, but that is not a strict requirement of the grant. So we'd certainly be open to hearing other reasons why it may be less.
If we received funding under the EQIP grant and have completed part of the 4 milestones for the communities grant, how would this impact our application to the communities grant?
So I'd have to see the specific scenario to be able to answer that more accurately. But if you were an EQIP grantee, you certainly can participate in the Connected Communities program. However, for the use case you identified under EQIP, you would not be eligible to propose that as your same use case under a Connected Communities program. It would have to be a different use case or a different set of trading partners and volume targets you would be going for.
Would it be acceptable to include a middleware appliance to facilitate information sharing among different EHRs and with non-TPOs as appropriate?
When you say middleware appliance, I will assume that you are talking about, in highway terms, a land box, or more generally, a Mirth box or a Rhapsody box or some integration engine. If that's what you're describing, then certainly yes, that would be acceptable.
If the collaborating entities are part of a single large system, does each entity count as a trading partner?
They do. Let me go back to my unaffiliated terms here to make sure I get this right. So there is a requirement, so there is an expectation that as we described, the 4 to 8 TPO type unaffiliated collaborators are expected. So we would expect roughly, between 4 and 8 collaborators to be unaffiliated, meaning not part of a common system. And there is a definition of affiliated in the solicitation I would encourage you to read. It is certainly okay, though, for more entities within one system to be collaborators. So if you're a system and you have maybe 4 hospitals and 20 different practices, you can certainly have multiple of those as collaborators. But there is an expectation that there is sharing or building of information pathways outside of your system that would call upon, we'll call it 4 to 8 unaffiliated collaborators.
If 4 TPOs within a certain region apply separately, would you recommend to each to combine their efforts into one application?
I would leave that to the applicants to decide on their own. I would say if your efforts are with one another, it may be a stronger application to propose it or submit it as a single application. But if there are different aims that you're going after, then it may be better for separate applications.
$100,000 only goes so far. Would that be a reason for minimizing collaborators?
No, the maximum award value is $500,000. You can certainly propose an application with a budget that is anything less than $500,000. So you could propose an application for $100,000, for $50,000, for $250,000, but not more than, I guess, $475,000 technically with the $25,000 planning payment. And that's over a 2-year period. So the funding may not go far for $100,000. But it goes further for $500,000, and I would leave it to you to decide how that would be distributed among collaborating institutions and then how far that funding could go. One of the big items under this program, though, is we recognize that there is a lot of technology that exists out in and among the communities already, and by using the existing technology with some add-ons, we think a lot of the funding under this may be more personnel related, which is where some of the funding decisions came from. That's all the questions that we see right now. We'll go ahead and hold tight for a couple minutes to see if more questions come in. Okay, that seems like that's all the questions that we have. Again, go ahead and submit your questions to the email address. We'll go ahead and work to answer all the questions that we received today, put that in the form of a question and answer document that we'll post on the solicitation webpage. I'll work to get that up there in the next week or so, and we'll incorporate whatever questions we get via that email address. So I welcome all of you to the program, look forward to your applications, and again, we'll have another webinar next Wednesday at 12 and encourage you to share this with others that may be interested in applying. Great, thank you very much. Have a nice day.
Thank you.